Hi, I am Dr. Naveen Mehrotra, Chief Neurosurgeon at the Sunshine Hospital, Secunderabad branch. So today I am going to share my experiences and views on a very common problem which we see in our day-to-day practice called as migraine. I think each one of us might have heard the name of migraine, as it is one of the commonest type of headaches which we see in our practice, and it is the most disabling one also. So what type headache is a migraine? So migraine is usually a one-sided or a hemicranial headache which usually starts in the front behind the eye, and it involves the half of the head and it goes to the behind. Sometimes it can be bilateral also. Bilateral meaning it can involve both sides of the head also, and it can start from the back of the neck and go and around the whole of the head. This headache is usually very severe and usually associated with photophobia and phonophobia, meaning thereby that when you get this headache, you don't want to see lights, you would prefer to lie in a dark room, and you don't want to talk to somebody, and even the noise or voice of the or talk of the children makes you so irritable that you sometimes beat them also. So this is the classical type of description of a migraine headache. Sometimes they are associated with aura or may not be associated with aura. Aura means that you have some predisposing features which make you feel that you are trying or you are going to get that headache. So this is called as a aura. So normally if you have a migraine, there is a strong possibility of a family history, meaning thereby if you have a headache, your mother, your brother, your sister or father might be having a headache, and this is passed on to you. So this is headache. The most important part of it is an episodic headache, meaning thereby suppose you have an headache, there will be a gap which will be pain free, and you may get a headache after maybe 2 days, 3 days or 4 days, or it may be so common that you can get it very frequently. Then comes how to diagnose a migrainous headache. The diagnosis of migrainous headache is usually clinical, and with the experience we find out that this is a migrainous headache. But sometimes we need to do the scan to rule out if we are missing out anything or not. The MRI which we do is done to rule out any possibility of a tumor or any focal or blockage in the brain, the venous system of the brain, called as the MR venogram, or to rule out that except migraine there is no organic cause for the headache or not. Then thirdly, what is the treatment for a migraine? Number one, migraine is usually a self-limiting disease, and the most important thing is that migraine is usually triggered by some triggering factor. So you have to identify the triggers which make you or which predispose you to have this migrainous headache. So the most important aspect of treating a migraine is that we should have a headache diary, meaning thereby that suppose you get a headache today, 24 hours before you chalk down what are the things which you did, like what you ate, even chocolates, sometimes non-veg food, or if the people who drink and wine can also cause you to have a headache. So try to note down as many points as possible, and try to see that whenever you get a headache, you note down all these points. So after maybe 4 or 5 times, you will see that you have figured that there are 3-4 points which or triggers are there which cause you to get the headache. It can be as common as a head bath, or it can be like a brand of a tea or coffee which you use or you change may trigger you to cause a headache. The advantage of doing is this: once you remove these triggers, you may not experience migrainous headaches. So till the time you have not figured it out why you are having the migraine, the treatment consists of 2 parts, like a prophylaxis for migraine, that means a medicine that prevents you from getting the headache, and secondly the treatment of acute headache. So once you have the features that make you suggest or you feel that you have a migraine, it is better to consult a neuro physician or a surgeon and get the medical prescription for it. Thirdly, then what is the outcome, or what is like I am going to have this migraine throughout the lifetime? No. Normally what happens, once you have found out what is the trigger for a migraine and you have removed them, you tend to be pain free in life. the most important thing is migrainous patients have a tendency to, they may have a possibility that they may have a stroke in future. So it is important that we figure it out that and try to prevent the attacks of migraine in the few patients. So there are different types of migraine. One is a classical migraine. Sometimes there is a severe that you may have weakness or paralysis on one side of the body. So once you have a migraine, it is important that you consult the doctor and try to find out a possible treatment for it. Thank you.
ఈ కాన్స్టిపేషన్స్ కానీ ఇంటెస్టైనల్ ప్రాబ్లమ్స్, ఇంటెస్టైనల్ అబ్స్ట్రక్షన్స్, తర్వాత ఇలా అనేక రకాలైన ఇంటెస్టైనల్ డిసీజెస్తో బాధపడే వాళ్ళకి ఈ ఫైబర్తో కూడిన మిల్లెట్స్ చాలా వరకు ఉపయోగపడతాయి.